Imagine sitting in a quiet room. Soft ambient sounds fill the space around you. This is a place for a calm and honest conversation. We are here to talk about menopause. It is a natural transition in every woman's life. It marks the end of menstrual cycles. Most women know the common symptoms: hot flashes, night sweats. They can be very disruptive. But other symptoms, quieter ones, are rarely mentioned. These hidden signs can be confusing and unsettling. They can make you feel like something is wrong, without knowing why. I am your unseen expert voice, a gentle guide. Menopause is not an illness. It is a biological process. It officially begins 12 months after your last period. The years before are called perimenopause. Your ovaries gradually produce less estrogen. Estrogen is a powerful hormone. It affects many parts of the body: brain, bones, skin. When levels decline, your body must adjust. That adjustment causes menopause symptoms. Symptoms can appear in many surprising ways. They are not always what you expect. This piece will shine a light on hidden symptoms. We will walk through them one by one. The goal: clear, simple information to let you know what you feel is real and that you are not alone. One of the most disconcerting hidden symptoms is what many women call brain fog. You may find yourself walking into a room and forgetting why you are there. The name of a familiar acquaintance might suddenly escape you. Following a complex conversation or concentrating on a detailed task can feel unusually difficult. These are not signs of a serious cognitive decline. They are very common during the menopausal transition. This mental cloudiness can cause worry. You might fear you are losing your edge or that something is seriously wrong. Please know, this is linked to estrogen. Your brain has many estrogen receptors. This hormone supports neurotransmitters, how brain cells communicate. It supports memory, quick thinking, and the ability to focus. When estrogen fluctuates and declines, this system can be less efficient, like static on a radio line. The messages are still there, just harder to hear, so words slip and thoughts feel slower. It is a physiological change, not a personal failing. For most, brain fog is temporary, most prominent in perimenopause and early postmenopause. Practical steps help. Be kind to yourself. Build supportive habits with calendars, lists, and reminders. Engage your brain with new skills and puzzles. Protect sleep. Exercise to boost blood flow. And speak with your doctor to rule out thyroid problems, vitamin deficiencies, or depression, and to discuss whether hormone therapy may be suitable. Another cluster of hidden symptoms relates to your emotional and cardiovascular well-being. You might feel uncharacteristically irritable or sad. Small frustrations bring you to tears. Alongside mood swings, a new or heightened sense of anxiety can appear. A constant worry, a racing mind, even panic attacks. This is not weakness. Hormonal changes affect brain chemistry. Estrogen helps regulate serotonin and dopamine. As levels become erratic and fall, regulation falters, fueling emotional volatility. Anxiety can feel powerful, dread or unease without a clear reason. You may notice palpitations, fluttering, pounding, or a skipped beat. It's wise to take heart symptoms seriously, but menopausal palpitations are often benign, triggered by hormonal shifts or anxiety. Adrenaline surges with anxiety, or a hot flash can make the heart race or beat irregularly for a short time. Manage symptoms with deep breathing, regular activity like walking or yoga, and limiting stimulants like caffeine and alcohol. Talk with trusted people. If mood swings or anxiety are persistent, severe, or interfere with life, see your doctor. Counseling, therapy, and safe medications can help you feel like yourself again. Many women are surprised to find new aches during menopause. You might wake with stiff fingers, sore knees, or aching hips, often called menopausal arthritis. Aging plays a role, but the drop in estrogen is major. Estrogen reduces inflammation and supports joint lubrication. When estrogen declines, inflammation and stiffness can increase, often worse in the morning and widespread. Skin may become drier, thinner, more fragile, and bruise more easily. Estrogen is essential for collagen, which gives strength and elasticity. New sensations like tingling or pins and needles, paresthesia, can relate to hormonal effects on the nervous system. These can affect quality of life. Joint pain limits activity. Weight gain strains joints. Skin changes affect confidence. Tingling can cause anxiety. Acknowledge, don't dismiss. Gentle, consistent movement helps. Swimming, stretching, Tai Chi improve flexibility and reduce stiffness. For skin, use gentle hydrating cleansers. Apply rich moisturizer, especially after bathing, and protect from the sun. For tingling, improve posture and use ergonomic tools. If pain limits mobility or numbness worsens, consult your doctor to check joints or nerves and discuss targeted treatments. Menopause can subtly affect the senses. One often overlooked symptom: dry, irritated, gritty, itchy eyes, sensitive to light with redness. Estrogen helps tear glands. Lower estrogen means less and poorer quality tears. The eye surface becomes irritated. Vision can change, slightly blurry. Glasses or contacts feel off. Hormones can alter cornea shape and lens flexibility, usually minor, but can cause strain and headaches. Taste and smell can shift. Foods may taste different. Aromas, harder to detect. Some notice a metallic taste. Hormones may affect taste buds and olfactory receptors. Subtle changes can impact appetite and enjoyment. Manage with lubricating eye drops and conscious blinking, especially at the computer, and take regular breaks. Get a comprehensive eye exam if vision changes. You may need a new prescription. For taste changes, experiment with herbs and spices. If eye pain is severe or vision changes suddenly, seek medical care right away. Small adjustments can provide real comfort and reassurance that what you notice has a name and reason. Many hesitate to discuss bladder and pelvic health, yet these are common hidden symptoms. You may urinate more often or feel sudden urgency. Leakage with cough, sneeze, laugh, or exercise. This is stress incontinence. Urethral tissues are rich in estrogen receptors. As estrogen declines, tissues thin and lose elasticity, affecting bladder control. You may have more urinary tract infections. Tissue changes and vaginal pH shifts allow bacteria to grow. These symptoms are grouped as genitourinary syndrome of menopause, GSM. GSM includes vaginal dryness, burning, irritation, making intercourse painful, called dyspareunia. Vaginal walls thin, become less flexible, and produce less lubrication, causing friction, soreness, even small tears. Many endure in silence, straining intimacy and well-being. This is treatable. Steps include Kegels, regular vaginal moisturizers, water-based lubricants, and discussing with your doctor low-dose local estrogen, cream, tablet, or ring, to restore tissue health and relieve dryness, pain, and urinary symptoms. A profound and persistent fatigue is another hallmark, often misunderstood. Not ordinary tiredness, it's bone-weary exhaustion, even after a full night's rest. It makes work, caregiving, and once-loved activities harder. This is physiological, not a character flaw. Hormonal fluctuations and other symptoms, night sweats, pain, mood swings, anxiety, rob vitality. Even without hot flashes, hormones disrupt sleep architecture, reducing deep, restorative sleep. Fatigue reduces exercise, leading to weight gain and cardio decline. Sugar and caffeine fuel later crashes. Stress compounds. Acknowledge fatigue. Prioritize sleep hygiene. Cool, dark, quiet room. Calming pre-bed routine. Avoid screens for an hour. Focus on whole foods, sufficient protein, and complex carbohydrates for steady energy. Gentle, regular exercise. Even a short walk boosts energy. Talk to your doctor about anemia and thyroid, and whether managing symptoms, possibly with hormone therapy, could help you feel vibrant again. Menopause can feel overwhelming, but you can take control. Become an expert on your own body. Keep a simple symptom diary in a notebook or an app. Note physical and emotional changes, hot flashes, sleep, mood, aches. This helps you and your doctor see patterns, link symptoms to menopause, and ease clinical conversations. Build pillars, daily movement, walk, gentle yoga or swimming, balanced diet with whole foods, lean proteins, healthy fats, consistent, restful sleep. You are not alone. Talk to friends, your partner, family, or support groups online or locally. Build small moments of calm, deep belly breathing, meditation, time in nature. Seek medical guidance if symptoms are new, severe, or harming quality of life. Seek urgent care for chest pain, fainting, sudden severe headache, or abrupt loss of vision. Bring your diary and questions. Ask if symptoms relate to menopause and about testing and safe treatments. Clear information empowers wise choices. Menopause is universal and natural, yet deeply personal. Its landscape is more varied than portrayed. Beyond hot flashes and period changes lie quiet, hidden symptoms. These are just as real and deserving of care and attention. My hope is that you feel seen, understood, less alone. That naming the changes and their biology brings relief. What you are feeling is valid. You are not imagining it. You are not overreacting. You are not simply getting old. You are experiencing the physiological effects of a major hormonal shift. Knowledge moves you toward empowerment. Small, consistent lifestyle changes can bring significant relief. Have informed conversations with healthcare providers. Advocate for the care you need and deserve. This transition is not just an ending, it is a beginning. A doorway to wisdom, freedom, and a new sense of self. Keep asking, keep seeking, keep talking. Your health, comfort, and happiness matter. You have strength and resilience, and you deserve to navigate this with hope, dignity, and a calm well-being.